explanation of the thyroglobulin TG test. Thyroglobulin TG test. The thyroglobulin TG test is a specialized laboratory blood test primarily used in patients with a history of differentiated thyroid cancer, papillary or follicular type. Thyroglobulin is a large glycoprotein synthesized and stored by thyroid follicular cells and acts as a precursor in thyroid hormone T3 and T4 production. Because thyroglobulin is produced only by thyroid tissue, its detection in the blood after a total thyroidectomy, surgical removal of the thyroid, and radioactive iodine ablation indicates the presence of residual thyroid tissue or recurrence of cancer. Thus, TG serves as a tumor marker and is a cornerstone in the long-term follow-up of thyroid cancer patients. Number 2. Definition. The thyroglobulin TG test is a quantitative blood test that measures the concentration of thyroglobulin protein in serum. Normal role of thyroglobulin, storage and release of thyroid hormones, T3, T4. Clinical role of test, tumor marker for detecting residual or recurrent thyroid cancer after thyroid gland removal. 3. Indications. The TG test is indicated in the following situations. 1. Post-treatment monitoring of patients with differentiated thyroid carcinoma after thyroidectomy and radioiodine ablation. 2. Assessment of recurrence or metastasis of thyroid cancer. 3. Evaluating completeness of thyroidectomy, residual thyroid tissue. 4. Monitoring effectiveness of radioactive iodine therapy. 5. Sometimes used in benign thyroid disease, e.g. multinodular goiter, Graves' disease, Hashimoto's thyroiditis, but not as a routine marker. Number 4. Used for cancer surveillance, checking if thyroid cancer has returned. Measuring treatment effectiveness, whether surgery or radioiodine successfully removed all thyroid tissue. Long-term monitoring, to detect recurrence early. Risk stratification, TG levels help categorize patients into low, intermediate, or high recurrence risk. Number 5. Why the need of this test? You may need the TG test if you have undergone thyroid cancer surgery, thyroidectomy. Your doctor wants to check if any thyroid tissue remains. To detect recurrence early, even before imaging can. To determine if additional therapy, radioactive iodine, surgery, or other treatments is required. This test is not used to diagnose thyroid cancer initially, but rather to monitor known patients after treatment. Number 6. What happens during the test? A nurse or phlebotomist inserts a sterile needle into a vein, usually in the arm. A blood sample is collected into a tube. The tube is labeled and sent to the laboratory. The process usually takes less than 5 minutes. In some cases, you may be given Thyrogen, recombinant TSH injection, or be asked to stop thyroid hormone therapy for a short time to allow TSH to rise, which stimulates thyroglobulin production. This is called a stimulated TG test and is more sensitive. Number 7. How long for my results? Most laboratories provide results within 24 to 72 hours, 1 to 3 days. Stimulated TG testing may take longer depending on the protocol. Number 8. Prepare for this test. Usually no fasting or special diet is required. Your doctor may ask you to temporarily stop thyroid hormone replacement, levothyroxine, or use Thyrogen injection to raise TSH. Avoid biotin supplements for at least 48 to 72 hours before the test. Biotin interferes with immunoassays. Ensure TGAB, thyroglobulin antibody, is tested at the same time. Number 9. Risks. Risks are minimal and limited to blood sampling, mild pain, bruising, or soreness at the puncture site, rare dizziness or fainting, extremely rare risk of infection or hematoma. 10. Normal values. With intact thyroid gland, general population, 3 to 40 nanomolar values vary with iodine status in laboratory. After thyroidectomy and radioiodine therapy, suppressed TG under thyroid hormone therapy, 0.2 nanograms per milliliter is expected. Stimulated TG after TSH stimulation, 1 nanogram per milliliter is expected. Important, reference ranges may differ by lab and method used. Number 11. Interpretation of results. Undetectable TG indicates no thyroid tissue or cancer is present, successful treatment. Low but detectable TG may reflect residual normal thyroid tissue, not necessarily cancer. Rising TG trend strongly suggests recurrent or metastatic thyroid cancer. High TG levels usually indicates persistent or metastatic disease. Note, always interpret results along with TG antibody, TGA results in imaging studies, ultrasound, radioactive iodine scan. Number 12. Factors affecting results. 1. TG antibodies. present in 25% of thyroid cancer patients. They can falsely lower or increase TG results. 2. Assay variability. Different labs use different methods. Always try to use the same lab for follow-ups. 3. Recent treatment. Surgery, radioactive iodine, or inflammation can cause transient TG elevation. 4. TSH level. TG increases under high TSH stimulation. 5. Iodine intake may alter TG production. 6. Medications. Biotin supplementation interferes with TG immunoassays. Number 13. Clinical significance. Most important tumor marker in differentiated thyroid cancer. Helps determine if treatment was complete. Detects recurrence earlier than imaging in many cases. Used with neck ultrasound and TGAB testing for complete follow-up. Not useful as a screening tool in the general population or for medullary undifferentiated thyroid cancers, since those cancers do not produce TG. Number 14. No more. TG testing is always paired with TG testing for accuracy. Stimulated TG testing with TSH rise is more sensitive for detecting small recurrences. Serial TG measurements trends over time are more useful than a single result. Imaging, neck ultrasound, whole body iodine scan, PET-CT is ordered if TG rises significantly. TG is not elevated in medullary thyroid carcinoma or anaplastic thyroid carcinoma. Number 15. Conclusion. The thyroglobulin TG test is a highly specific and valuable tumor marker used to monitor patients with differentiated thyroid cancer. After thyroidectomy and radioactive iodine therapy, TG levels should ideally be undetectable. Persistent or rising TG indicates residual or recurrent disease, guiding further management. Although it is not a diagnostic tool for thyroid cancer in the general population, it remains a cornerstone in post-treatment surveillance and prognosis. Thank you. Have a nice day.